What actually happens inside your colon when you have diverticulosis? These tiny pouches can form inside your colon for decades without you ever knowing they're there. But how do they actually form? The human body is doing millions of things every second, most of them without you ever noticing. Today, we're going inside your body to see exactly what's happening and why it matters. Most people think diverticulosis is a disease. It isn't. It's actually a slow structural change that can take decades to develop. And to understand it, we have to go inside the body. This is your colon, also called the large intestine. By the time food reaches here, almost all of the nutrients have already been absorbed. Now, the colon has a different job. It removes water, forms stool, and slowly moves waste toward the rectum. It performs this job every single day, without you ever noticing. Although the colon looks like one continuous tube, it isn't equally strong everywhere. Tiny arteries have to pass through the muscle wall to deliver oxygen and nutrients to the inner lining. Every place a blood vessel passes through, the muscle becomes just a little thinner. These aren't injuries. They're completely normal anatomical weak spots. Every human colon has them. Now imagine something that happens thousands of times every day. Your colon contracts again and again and again. Each contraction creates pressure inside the colon. Most of the time, nothing happens. But over years, those repeated waves of pressure keep pushing against the same weak spots. Not for days, not for months, for decades. Imagine squeezing a balloon that's slightly thinner in one small area. The pressure doesn't spread evenly. That thinner section begins to bulge first. Something remarkably similar happens inside your colon. After years of normal digestive activity, the inner lining slowly starts pushing outward through one of those naturally weaker spots. Not suddenly, not overnight, but millimeter by millimeter, year after year. That tiny outward bulge is called a diverticulum. Over time, more pouches may form as the years pass. Other weak spots experience the same pressure. Another pouch forms, then another, and eventually, several small pockets may line sections of the colon. At this point, the condition has a name, diverticulosis. So why does this become more common as we get older? Because your colon changes with age, just like your skin loses elasticity, just like your joints become stiffer. The connective tissue inside the colon gradually becomes less flexible. The muscle wall isn't failing, it's simply becoming less resilient after decades of use, which means those weak spots become even more susceptible to pressure. Here's the part that surprises almost everyone. Even after these pouches form, most people never feel them. The pouches themselves often cause no symptoms. They can sit quietly along the colon wall while the colon continues doing its job. The colon continues moving waste. Water continues to be absorbed. Digestion continues normally, which is why millions of people discover diverticulosis completely by accident, usually during a routine colonoscopy. Not because they felt sick, but because they were looking for something else. For most people, the story ends here. These pouches never lead to serious problems. They remain quiet, stable, completely unnoticed. But occasionally, one or more of these pouches become inflamed. This is no longer just diverticulosis. This is diverticulitis. And although the names sound almost identical, what happens inside your body is completely different. Inflammation changes everything. As immune cells enter the area, nearby tissues begin to swell. The colon wall becomes more sensitive. Nerve endings that were never activated before now begin sending pain signals to the brain. Each normal muscle contraction, each movement of stool through the colon can stretch or press against that inflamed area. That's why the pain is often persistent instead of coming and going. And because diverticula most commonly develop in the sigmoid colon, the pain is usually felt in the lower left side of the abdomen. Pain isn't the only thing your body notices. Inflammation releases chemical messengers called cytokines. These molecules travel through your bloodstream. When they reach your brain, they reset your body's internal thermostat. That's why many people develop a fever. Those same inflammatory signals can also affect the stomach and nervous system, reducing appetite, triggering nausea, and making you feel generally unwell. It's your immune system responding to inflammation, not just inside the colon, but throughout the body. Here's the part many people never hear. Having diverticulosis does not mean you'll develop diverticulitis. In fact, most people never do. The pouches often remain quiet for life. Understanding the difference changes everything. One describes the structure of your colon. The other describes an episode of inflammation. Knowing which one you have helps replace fear with understanding. And understanding is one of the most powerful tools you can have after a diagnosis. If you've recently been told you have diverticulosis or you're trying to understand what it really means, don't rely on myths or frightening stories. Learn what's actually happening inside your body. Scan the QR code to get everything you need to know about diverticulosis, a clear, reassuring guide for the newly diagnosed. Save this video so you can come back to it whenever you need it. And follow for more science-based explanations that make complex medical topics easier to understand.